Here. So AI and telehealth. Well, everybody, I'm sure, has heard of AI. Now, whether or not you're sick of AI yet is a whole nother question, because there's a lot of hype around it. There's a lot of reality to it. It certainly is going to be part of everybody's lives, and probably already is in many ways that you're absolutely unaware of, because it just runs completely in the background of our lives. But let me just kind of go through a lot of trends that I've seen and a lot of potential opportunities that relate to healthcare in general, in many, many ways, but to telehealth in particular in some other ways. So one tool that is significantly impacting just healthcare in general, but I think is going to be a real useful tool for telemedicine as well, as ambient clinical intelligence. And basically what this is if you've been to your primary care provider, because that's where it's mostly being seen so far, especially with chronic care patients, where you've got multiple things going on and a lot of information going back and forth between providers and patients. It's basically a AI-run device that listens in on your conversation and takes scribes. So it's an AI-based scribe in a sense. So in the past, we'd have medical students or high school students volunteer to get clinical experience. There would be scribes during these sessions, kind of write down all the notes. Well, they don't have to do that anymore. Unfortunate for the medical students who wanted experience, or for the high school students, college students who wanted experience to get into medical school, because now it's being done automatically. These are really time-saving devices. It just sits there, and like I said, it literally records and transcribes the entire conversation, corrects all the grammar and everything, and uploads it into the EHR, all automatic. And what it allows the provider to do is really sit there and listen to the patient. How that's useful in the telemedicine world is now you don't have to worry about taking notes and not looking into the camera. In the real life setting, it used to be for, I don't know, ever since the EMR came out, that the provider all of a sudden wasn't talking to you anymore. They'd be talking with their computer or looking at their computer trying to take rapid notes. They don't have to do that anymore. This just totally takes care of it. The patient, the provider can talk to each other, interact. And again, in the telemedicine setting, the provider can maintain attention on the camera and on the patient on the other side. So it's really a significant impact clinically. It is saving providers immense amounts of time in terms of literally hours after work. What a lot of providers would do is take rapid notes right after a clinical encounter or during an encounter, and then, or at the end of the day, have to put all this information in the EHR. It is literally saving people hours of time and getting information, accurate information and complete information into the EHR. It is possibly adding technology into it, AI predictive, that can actually analyze what's going on in the conversation, pick out cues that perhaps the provider didn't catch on to, and provide some feedback and say, hey, did you notice that the patient was X, or did they notice that you said this? And it can provide some analyses, some predictions. It can also help place orders. If it's mentioned during the course that, yes, I'll renew your prescription for amlodipine at your local CVS, this system can keep track of that and actually then place the orders. It is going to have a significant role in reducing provider burnout and reducing errors. Again, anything that's going to reduce provider burnout these days is incredibly, incredibly important and useful. So this is one AI tool that I think is already having an impact and will continue to do so, and really in terms of telehealth is useful as well. There's another type of technology, embodied AI. And basically, this is literally what it sounds like. It's putting AI into a body, and that body is robots, virtual assistants, all sorts of other intelligent systems. And what it has is sensors, and these are usually visual, quote unquote, cameras that these devices have, as well as audio, so they can record and output audio as well. But they have all these sensors that can import data from their surroundings, and then the AI systems analyze it, learn it, and they interact. It can actually develop some abstract representations, understand spatial and temporal dimensions, solve real-world tasks. These are robots. And they are already being used clinically, but they're getting much more sophisticated over time and as the AI gets better. And some of these robots, the AI is there. What we really need is sort of the mechanical side of things. Some of the robots that you see are, there's still Abe Lincoln at Disney World animatronics, but there's some really sophisticated ones out there, especially a lot of the robots that are being developed for healthcare in Japan, and those that are being developed by the Department of Defense and their contractors for use in healthcare in the battlefield situation and other situations like that. So some of these embodied AI robots are able to lift patients, move patients from, say, their gurney onto the MRI table, pick them up off the floor if they've fallen, put them back on their bed. And they can roam around hospitals, they can learn spatial orientations, they can go in and check on patients and so on. So these are really cool AI type devices. Their practicality for a number of years was like, really? But now we're getting to the point where they are truly becoming useful devices in the clinical setting. In terms of telemedicine, what it allows you to do is these robots can serve as a surrogate almost for the provider, and they are being used for this. They've been using these for quite a while. But you can have on the little screen on the robot's face, the face of the provider who's at a remote distance, interacting with patients, say in the ICU, as they go around and do their rounds, where the provider is actually off-site, but the robot is going around and taking the place of that provider. So you could do tele-ICU, tele-rounding with devices like this. And like I said, it doesn't have to be a robot. There's other systems, virtual assistants, and other types of devices that are out there that are being driven by AI. And they're really learning to not just do what you program them to do, but to react to their environments. And that's where it's getting really sophisticated, where they can develop these abstract representations and understanding of what's going on. So they can potentially be in a patient's room and see and sense that the patient is trying to get up and intervene in a sense, and put the patient back down, or raise its robot arms to try to help the patient get up, or whatever you want it to do. But they are getting very complex in what they're doing. And again, in terms of telemedicine, you can do these interactions with patients virtually with these robots. And it has a lot of potential, again, to change things out at rural sites. I'm going to talk about the challenges of some of these later on. One of the most fruitful places for AI is actually in the electronic medical record, and it's being used there in many situations. And again, a lot of this is probably going on in the background that a lot of people just simply aren't even aware of. I have listed there on the right just some of the areas where the AI tools are really getting quite sophisticated now and being used to help providers across the spectrum take care of patients. Predictive analyses is one of the huge ones. And this is simply being able to take data from multiple encounters, look at the labs, look at EKGs, look at all the data that belongs to a patient, and try to predict not only what the course of their disease might be, or are they on a trend towards their A1C levels always being consistent, or is their blood pressure slowly going up and nobody's noticing. But they can also potentially predict when a patient might have some sort of event that's going to need an intervention. Data visualization is huge when you consider the amount of data that patients have, especially chronic patients with multiple conditions. The problem is that if I'm a neurologist, I tend to look at the neurology data. If I'm a radiologist, I'll look at the radiology data. But trying to take all the data in the electronic health record and get a global picture of what's happening with the patient, it's incredibly difficult. And it's been a challenge for a number of years, not only in how do I extract all this information, but then how do I present it to the providers. Artificial intelligence is helping immensely in this area by going through, collecting all the data, sorting through it, creating spatiotemporal maps, in a sense, of what has the patient gone through from the first time it encountered the healthcare system. When did it see the radiologist? When did it get the pathology results? See the neurologist, see the diabetician, whoever. And it can create visuals of what that patient has encountered, what they've gone through, and what the timeline and time course of their care has been. And this is really transforming the way that we take care of patients. Oncology, cancer patients, this is immensely useful because you can see what the patient's gone through, what their contacts have been. And when you bring in other data like the predictive analyses, you can see, well, okay, this medication's not working or this intervention's not working. Let's move to something else. And you can do that far quicker than you could have just by sorting through the data manually. Natural language processing is helping immensely as well. Again, utilizing AI-based tools to go through written information in the electronic health record and elsewhere and create all sorts of summaries of data. Utilizing natural language processing, for example, to go through radiology reports and create versions of them that are more patient-friendly. And not just radiology, oncology reports, primary care reports, everything. Natural language processing can go through these written documents and create things at a level that is understandable by, say, the average sixth grader, which is what is recommended for most reports to be at for the general public. It can create summaries. It can send information to providers. You know, when you look at a report from any physician, a lot of times there's words, there's languages in it that people just really aren't familiar with. The natural language processing can put this information in common everyday language. It can help with security and privacy, mapping out pre-existing conditions. It can do not only diagnosis, but it can do prognosis, trying to predict what's going to happen with the patient. Data fetching, it can do data normalization between different systems. You can do patient matching with it. A big problem in errors is doing something on the wrong patient surgeries, wrong patient images, all sorts of stuff. Artificial intelligence can help with all of this as well. A huge way that artificial intelligence can help is with automatic reminders, sending automatic reminders to patients and send them text messages. Your appointment is in 2 weeks. Let us know if you're going to show up, yes or no. You know, 2 days beforehand, are you still on track? Oh, by the way, we're taking blood. Remember to fast for 12 hours, things like that. And all of this can be done automatically with artificial intelligence going through the record. It has been shown to reduce no-shows, and reducing no-shows is huge because it improves efficiency and allows all the slots to be filled in a day. So it's a benefit to the healthcare system as well. And it also improves follow-up visits. A lot of times patients are recommended to do something by their provider. You know, here, you know, come back in 6 months. We want your blood in 6 months rather than a year. Or remember to get a follow-up. You got your annual mammogram. We noticed something, but we want to do an ultrasound. We need you to come back. Artificial intelligence can go through the record and see, well, this patient was recommended that they had to come back in 6 months. It's 7 months. They haven't come back. Let me send out a reminder. You can do that with AI. Health information exchange. It can get information into there and out of there. It can improve billing accuracy. huge for healthcare systems in terms of getting the right CPT codes, not getting as many claims rejected and so on. In terms of, and all of this applies to telemedicine as well. You can create triaging algorithms that you can provide to your schedulers or to your online scheduling systems, where a patient can go in, put in their symptoms, and automatically the AI will triage through and say, well, you know, these symptoms indicate that you would be best suited for a telemedicine visit. There's no need for you to come in person. Let me schedule this for you. The AI can completely do it. So again, all of this is highly applicable to telemedicine, as it will help improve the efficiency with which people are seen, and the data can actually get to the right people at the right time. In terms of telemedicine and all of this, if the provider, the telemedicine provider, doesn't have access to, say, a local EMR, but needs, the patient is seen by the telepsychiatrist, and the telepsychiatrist wants to get that information into the electronic health record of the primary care provider, all of these AI tools can help with that, because they can cross the barriers of interoperability in terms of identifying the patient remotely and so on. So a whole lot of cool stuff going on. AI and wearables, this really is sort of, you know, cutting edge technology, hardware technology combined with software and artificial intelligence. There are an immense amounts of wearables that are being developed these days. You see them on TV, glucose monitors, blood pressure monitors, all these watches that you can buy that have the ability to collect data, cardiac signals, blood pressure, glucose levels, like I said, A1C levels, your sweating levels, all sorts of things that you can monitor. They can be embedded in suits. They can be embedded in watches and rings and socks, all sorts of stuff. And what the artificial intelligence does, and why it's useful here, is all these sensors, technologically, we can collect signals every second, every half second. It's a ton of data. And it's all being collected remotely as the patients are walking around. Well, no human being can sort through that much data. Artificial intelligence has to be applied to these data in order for us to figure out what's going on. Otherwise, the data is absolutely useless. And what the artificial intelligence is really getting good at is figuring out what's the patient's baseline, what's normal for them. That's what we've had problems with in the past. So if I can figure out what's normal, then once I get signals that are out of range of normal, then I can alert the provider, hopefully without too many false positives or false alarms, because false alarms is what we've had problems with in the past. And like I said, AI is really getting sophisticated about that, and taking the information that these remote patient monitoring tools are gathering and truly making them useful. Some of the more interesting ones that I like here is the socks. That pair of socks there, they were developed to help with tracking. And so you put the socks on the patient, and they're for tracking purposes. Now you're sitting there, why on earth would I want to track somebody? That sounds rather Orwellian and Big Brother. Well, think about an Alzheimer's patient or a patient with dementia. They tend to wander. They can get up out of bed. Sometimes they're wandering in the streets. These socks actually track the patients. And so you know where they are, unless, of course, they take their socks off. But you can unobtrusively, in a sense, track them. And if all of a sudden, you know, they're not in the room you expect them to be, you just kind of log on to your device and say, oh, okay, they're in the kitchen, or they're down in the basement, or no, they've wandered off outside the house and they're 3 blocks away, potentially wandering. I have to go get them. The goggles there are interesting, and these are allowing people to interact in ways that they haven't in the past. Again, possibly for telemedicine purposes, where you no longer may need a device like a computer between you, you could potentially do telemedicine both on the patient and the provider side simply with a set of glasses that creates a virtual environment or augmented reality environment simply through the glasses, and sort of like the heads-up display on a pilot or even some of the cars that you have now. These glasses can allow you to do remote telemedicine visits without phones, without computers, simply with a set of glasses. So really cool stuff. The ring there, that's actually quite sophisticated. A lot of technology in that. You have to go back far enough, but there were these things called mood rings. And they were rings, basically they came out in the 1970s with a stone that would change color depending on basically on how hot your hands were. And this is sort of like the 21st century version of the mood ring, but it does a heck of a lot more than just tell your mood. It records all sorts of information, and some of these can actually signal, you know, your blood pressure is really going up, or there's something wrong with your heartbeat, contact your cardiologist. And some of these devices, the watches, the rings, have literally saved people's lives with their remote monitoring capabilities. And this is 100% telemedicine and truly the future of healthcare in general with these devices. You know, some of us use these casually to, you know, real-time health monitoring, check our heartbeat and our paces and the number of steps we take a day. But there's so much more that these tools are going to be doing and already are. A fascinating area of AI is biomarkers. And biomarkers are basically signals that we get about people's biology. And can we simply monitor some of these signals that are there in our bodies and telling us information about the patient that we may not know of? The most familiar ones are, you know, our blood, our O2 levels. I mean, all sorts of things that we've monitored in the past, but now we're getting far more sophisticated. So for example, the one that's being used very much so in many circumstances is voice. And again, this is incredibly useful for telemedicine. For example, in telepsychiatry sessions. You know, when I'm interacting with a patient virtually, I'm missing information. Depending on the quality of the audio, the visual, I am potentially missing out on subtle changes in the patient's voice or their face. I'm missing out on the whole bottom half of my body. You don't know if my, you know, am I tapping my toes 20 miles an hour because I'm very, very nervous or something. And so these sensors that can be embedded in any, you know, computer monitor simply to, or any computer to analyze what's going on. These voice recognition sensors and AI-based tools can literally analyze a patient's voice and tell you, this patient is anxious, this patient is depressed. Go down this route of questioning. And you may not pick up on it, but the computer's picking up on these signals that are indicating something's going on with the patient. Same thing with the face. It can detect simply by looking at the face something that's going on. This one is for mental health analysis. It analyzes the forehead, the eyes, the lips, and all of these are indications of, well, this person is potentially under a lot of stress. This patient is possibly depressed or anxious, and it will give you that feedback unobtrusively. The AI does this in the background based on the image on the computer screen, and simply sends you, you know, a little information on the side to the provider. Hey, ask the questions like this to the patient to find out, you know, are they feeling depressed and so on. Simply looking at the eyes, there's an amazing technology that an AI-based system can simply look at the eyes of infants and with nearly 100% accuracy, earlier than anything else, can tell you if potentially this child is autism spectrum disorder. Amazing technology, literally, like I said, about 100% accuracy, very, very close, simply by taking an image of the eye and analyzing it. Gait analysis, looking at somebody's gait to figure out if they're angry, if they're sad, if they're happy, if they're depressed. There's so many things that can be serving as biomarkers that we are simply unaware of, yet the computer amazingly can pick up on these things. Again, for telehealth, this is absolutely amazing technology because, as I said, in telehealth, we're typically limited by what we can do interacting. Well, now if I can simply tell the patient, okay, step back and let the camera watch you as you walk closer and farther away from the camera, or walk from side to side on the room. An AI system in the background can monitor this and possibly detect your emotion, but also analyze your gait in general and say, for example, for telerehab, well, you're still moving your, body this way. Are you having problems with your left knee still? Oh yeah, by the way, I am. I forgot to tell you that. So a lot of these tools can be used as biomarkers. And again, they're all AI based and incredibly useful for telemedicine visits, where again, you're limited in the types of information you can get. Chatbots. Oh, chatbots can do just about everything. They used to be incredibly annoying. They're getting a heck of a lot better. And there are times when you can't tell whether or not you're talking to a chatbot or a real person. They can help locate healthcare services, collect patient information. They can schedule appointments. Again, these are tools that are developed where you're literally just talking with a computer, and the computer is paying attention to the conversation, checking your symptoms, looking in the background, doing some algorithms that they're programmed to do, and they can tell you, okay, this sounds like the flu. Did you get your shot? No. Here, go order some Tamiflu or whatever. It can help schedule appointments. It can provide necessary information. You can call up, get automated prescription refills, vaccination reminders. I mean, just about anything and everything. If a chatbot can really understand coverage and claims, all the more power to it, because I think nobody really does understand coverage and claims anyway. But if you can get an AI to do that, it's incredibly useful. So chatbots are out there, they're being used. And again, I'm sure you've all talked to chatbots on the phone without even realizing it. There are apps out there. There are hundreds of apps, and most of them these days are being run by artificial intelligence. And some of them can be empathic. They're chatbots for mental health. They're right there on your phone. They are actually being shown to increase access, lower costs, improve healthcare. And this is all telemedicine because it's patients being cared for at a distance. There's tools for your heart, for cardiac, every clinical specialty, basically. You can use your phone these days with a small app, and you can just simply point it at, something funky on your skin, and it can tell you, no, that's something you could probably go ask your dermatologist about, make an appointment, or no, that's nothing, or that looks like poison ivy, go sit in a vat of tomato soup or whatever. Again, biomarkers, apps, wake and sleep cycle, all sorts of stuff. And there's statistics out there saying that nearly 80% of Americans prefer managing their healthcare experiences with technology. So this really is the way of the future. And like I said, all of these apps that you can simply download, whether or not they're health grade apps that are, FDA approved, or whether these are just off the shelf apps, all of this is AI based and helping healthcare. In some situations where it's helping clinicians with tasks that they, are really bad at, human beings are really bad at two things that are really a big part of healthcare: counting and measuring. And there are circumstances where AI is really helping in these circumstances. And most of them are image based. So in pathology, one of the tasks of a pathologist is literally they have to go through and count cells. And like I said, we're incredibly bad at this. If you've ever had to count a bunch of something, you're counting 2, 4, 6, and then you get distracted and it's, 10, 11, 12, or, now I got to go back all the way to the beginning. Automated artificial intelligence tools, this is simple for them, and it saves time, it increases accuracy, and so on. In radiology, one of the things I hear radiologists say is, if I could just get something to label the vertebra, because when they have to do the reports, they have to report everything, and sometimes I'll have to literally by hand, I've seen them go through, this is T1, T5, and they'll just do that. Why don't I just get AI? It's incredibly good at it. Just do it. Very good. So measure and count. Well, where are the challenges? All of this sounds really cool, right? But there are challenges. And some of the challenges that we have are, where on earth do we apply it effectively? Because the problem is there's a lot of lack of internal expertise in institutions. There's a lack of understanding about compliance and regulatory issues, and there's user trust. You know, do I really trust this AI system? And part of the problem is you're going to get these salespeople coming to you. It's great. It's going to solve all your problems. It's never wrong. It does this. It does that. It's going to make your life so easy. And then you buy it and, you know, it doesn't do half the things they said. So it really is a difficult thing as to where do we apply these tools in our healthcare systems and in telemedicine in general. AI systems, they hallucinate. They make things up. And so again, that goes back to user trust. They're not always 100% correct. They do make mistakes, and literally they will make things up. So when we're utilizing these tools to monitor biomarkers, to create and generate reports and so on, we got to worry about that. One of the biggest ones is, what is the return on investment and where's the money for implementation and infrastructure? There are literally thousands of AI tools out there. The problem is, for the most part, they're unitaskers. They do this. The problem is, in healthcare, in telemedicine, we need it to do that, everything. And that means I'm going to need an AI system for this, one for that. The return on investment and the model for doing this is not very clear at all. Because the model for the companies is, I'm going to sell you this AI tool, or I am going to lease it to you or license it or whatever, and you're going to use it, and what? Are you going to save money? I don't know. I can't guarantee it. Is it going to be billable? There's not a whole heck of a lot in this entire arena that's actually billable. So where's the return on investment? If I'm going to spend, and these aren't cheap, $250,000 to buy your AI system, somehow as a healthcare system, I've got to make that up. That's part of the problem. We just don't know. CPT codes aren't there. There's huge questions around ethics of using these in general, but also the accuracy, the value of an AI system all depends on how it's trained and the data that it's trained on. For the most part, a lot of the AI systems that are out there are not based on broad populations of patients from different backgrounds, races, genders, and so on. So there are significant biases in these systems. And if there's biases in the systems, in the way they're trained, in the way they analyze the data, they could, for example, triage somebody to telehealth where it's inappropriate. They could recommend X for this particular patient, but that's appropriate for your average middle-aged white male, not for your young African-American woman. So there are biases in the AI. There are legal issues, privacy, security, data. Who owns the IP? Who owns the output from the AI systems? A lot of questions we don't know. There's huge lack of clarity around the quality of the data that's one used to train these systems as input to the systems. The quality of the data from your electronic health record is going to affect the ability of an AI system to utilize that information. So huge questions around the quality of the data. There are some clinically irrelevant performance metrics out there. I read a lot of articles, and when you look at what they're measuring, it has nothing to do with clinical outcomes. A lot of it has to do with, well, how fast can I do this? I don't really care how fast it is. I want to know how accurate it is, and does it actually impact patient care? There's flaws in the research behind a lot of these AI tools. There's very little transparency or explainability to many people. What's going on in the AI is a big black box, and that's how it's referred to. It's a black box problem. I don't know what the AI is doing. There's a case that I'm aware of, and it's not the only one, where a patient came in because they were experiencing pain. They had imaging. Imaging found nothing. Sent the patient home. Maybe it's gas or something. A couple months later, patient comes back again. Let's do some imaging. Still don't see anything. Put an AI on it. The AI said this person has pancreatic cancer. The oncologist looked at it. Radiologist looked at it. Everybody looked at it. They could not see anything in the image. Sent the patient back home again. 6 months later, now we can see it on the imaging. But the problem is, if I had done something 6 months before, when the AI detected it, what could I do? I can't cut it out because I don't know where it is. I don't know what the AI is seeing. I can't cut it out because nobody can see it. I can't treat it with radiation, again, because I don't know where to direct the radiation. And I can't just put somebody on chemo if I don't know what it is. So there's these challenges of AI may be 100% correct, but I don't know what to do with that information because it lacks transparency and explainability. And then there's two areas that I, as an experimental psychologist, am very worried about, which is skill gaps and de-skilling. What level of experience do I need in order to be able to utilize these tools? Do I allow medical residents and fellows to use these tools in a telehealth situation? Do I allow non-medical professionals access to these tools to help them diagnose patients, or to, other providers, ancillary providers, the non-MDs? The AI is a very useful tool. Is it a crutch? Am I de-skilling providers by giving them AI tools, taking away skills? And the best example is GPS. Everybody used to know how to get around town. I don't know very few cab drivers these days who don't use GPSs. It used to be you get in a cab, you say this, they just drive away, they know where it is. Now everybody wants you to plug it into their GPS. It is a real phenomena called de-skilling. We are taking away valuable skills by providing people with these AI tools. Is the same thing going to happen in healthcare and telemedicine? I've actually got some grants right now that we're looking at just that. And I think the answer is probably yes. So although there's a ton of really cool stuff and potential with AI, I always like to bring people back to the fact that there are still some challenges that we face in terms of figuring out where exactly is AI going to really help us in telemedicine and healthcare in general. So that's just sort of an overall summary of sort of what's going on in AI these days and in telemedicine.